Is microneedling with hyaluronic acid as effective as microneedling with PRP? Looking for best microneedling treatment for acne scars, fine lines, skin tone texture, and tightening. Thank you.
Thank you for your question. You're asking is PRP, or I should say microneedling with PRP equal to microneedling with hyaluronic acid? And you're basically looking to improve acne scars, fine lines, skin tone, and texture. Well, I can certainly give you some information based on my experience. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. The use of microneedling, platelet-rich plasma, is something that I have a lot of experience with, hyaluronic acid fillers as well. In fact, I'm a member of the network of Vampire Facelift physicians, and I've actually been featured in the media a few times in regard to PRP and the vampire facial treatment, and some celebrities who have used it. So I think that, first of all, whenever you start asking questions about procedures and you've already kind of decided that you want to do microneedling and or for example combining what combination is ideal, you always have to go back to what is the core issue of the skin that has to be addressed, and then you can do some comparison. Acne scars, for example, is one of the areas where there are a lot of different treatments that can be combined in different ways to address this challenge of acne scarring. To understand acne scarring, you have to think about the inflammation that resulted in acne cysts that ultimately resolved by the skin healing with scar tissue, and there being, in the majority of time, indentations or depressions. Now, in our practice, my approach to acne scars is typically about addressing them from the inside first. I understand with the concept of microneedling, you're creating multiple little openings and you're trying to get the skin to tighten. But it has been my experience, particularly for more wide or deep acne scars, that I combined an approach where I'm actually using PRP and hyaluronic acid, but probably in a way that's different than what you're considering. I actually do subcision and release the acne scars, and I'll combine the hyaluronic acid filler, such as a Juvederm Restylane, with platelet-rich plasma to stimulate tissue growth on the inside at the deeper levels. A lot of times acne scars get treated by superficial treatment. This can be or working from the outside in. This includes the use of lasers or something like microneedling. And when you're thinking about microneedling, you're asking, would PRP be necessary when you apply it to the top of the skin versus hyaluronic acid? Well, I think that PRP is better as far as from the surface perspective, even though the actual penetration and depth and effect of the PRP can be up for debate. But I would say that if you are doing something that is stimulating the dermis, if you think about it, the wound healing material that is concentrated in platelet-rich plasma will probably stimulate more of a collagen response, a healthy skin healing response, more if you're applying it from the top in comparison to hyaluronic acid. Hyaluronic acid is not necessarily the same as Juvederm in terms of its thickness, but there are manufacturers who offer a hyaluronic acid topical to be combined with microneedling. But I would say that from my experience, injection of platelet-rich plasma, subcision of acne scars, and then as a finishing touch, doing something on the surface, such as microneedling, has been more successful for me in my practice. I feel like instead of working from the outside in, I work from the inside out. And the rehabilitation of the skin from acne scarring using platelet-rich plasma in an injection form rather than in a microneedling superficial form, I feel works very well. Very often I'll do a combination where I'll do the injection and the treatment from the inside, and we'll do something like Hydrafacial, which is a glycolic acid and water-based treatment of the skin that's like a microdermabrasion but using water with infusion of glycolic acid. That way we do deal with the superficial skin, which is not to be neglected, but I feel like I get a really nice result without having to make so many penetrating openings in the skin with microneedling. Microneedling is great, but it has to be used strategically. And understand that acne scar treatment and skin treatment, textural treatment, lines, etc., is not a one-time event. It's always an overall treatment plan that I discuss with my patients to understand that you can't get always everything at once, and to figure out a way to strategize things so that you get the most value with every time you actually go through a procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.